The right time. Welcome everybody. Nice to have see so many of you in person. And I know we've got a couple of changes. So we've got thank you from that's from St Mary's from the NHS Trust. And then we've got Andy, who's on behalf of Jim Pegler, the police. Thank you. All right. Okay. Thank you. And oh gosh, there really are some changes here today, aren't there? This could be dynamic today. Not saying that it's not always, of course. Okay, so moving on to the agenda. Oops. We've got minutes from the previous minutes. Is there anyone that would like to approve that they're a true record? Bearing in mind we've got a number of... Chris, is that to approve? Thank you. Is there anyone else that was here that can say that was a true record? Yeah, that's lovely. Thank you very much. I'll sign those. Okay, so we move on to item 2 on the agenda, which is declarations of interest. Are there any declarations of interest, please? No? Okay, none received. Thank you very much. We move on to item number 3 on the agenda, which is public question time. We've not been notified of any public questions. John Nicholson? Councillor Nicholson.
Thank you, Laura. The question I want to ask, please, is what is the board doing to address the shortages in professionals in pharmacy, doctors and other medical? So we've got education people here, we've got all sorts of people here. So I just wanted to know what was being done. Thank you.
Okay, is there anyone that can answer that? I mean, you know. Michaela, so we have Michaela. Welcome to your first meeting as the Isle of Wight Council Clinical Commissioning Group at this moment in time. Very nice to see you in person.
Thank you.
And thank you for stepping forward.
Thank you. If I cover them off one by one, and Councillor Nicholson and I had a conversation, I think only 2 days ago, and the pharmacy issue. So there has been a shortage of pharmacists for some time, but it has become particularly acute, I think, in the last couple of months. And I know that a number of individuals have flagged shortages in particular pharmacies across the island. For people who aren't aware, pharmacies are commissioned by NHS England rather than by the local CCG. So we are working really closely with NHS England, and Councillor Nicholson has shared with me some of the details of shortages. There's quite a lot we do locally to try and recruit and retain pharmacists and people like pharmacy assistants to support them, but it is very clear that we have got a local shortage as well as a national shortage. I haven't got sight, Lorna, kind of 4 weeks in post, I haven't got sight of the detailed action plan, but if you're prepared for me to share more details outside the meeting, I'm really happy to do that. I think it's also fair to say that you'll be really cited on the fact, and I'm sure you've probably talked in meetings before, about the wider workforce challenges across the whole of health and social care. And actually, we met together yesterday as a partnership board, and Laura Gordian was in that meeting, Michelle, Darren from the Trust and many colleagues, about the whole range of workforce challenges we've got. And there are different programmes of work to address those. So specifically, there's a programme of work around carer shortages, which actually is the most critical issue which is facing the island at the moment. And there's a joint plan in place. We've actually got a workshop that's been developed with all partners, which I think the date is the 17th of May, but I will check that. But 17th of May is large in my head, to look at how we can develop more roles that straddle health and social care. And I think they will be critical. And again, the Trust, and Lois might want to comment, but the Trust has an extensive workforce plan around some of its challenges and shortages. Do you want to talk about some of the specifics, Lois?
Thank you, Chairman. Yes, absolutely. We are taking a very creative approach, we believe, to addressing shortages in a number of our professionals, including reviewing a lot of our service delivery models to make sure that we only allocate tasks that must be done by registered professionals to those registered professionals, making sure that we free up their capacity to focus on those things by backfilling the rest of their time. We're also introducing a number of extended and enhanced roles, such as physician associates, and working with universities, including University of Portsmouth, to make sure that we can provide a properly accredited qualification route for those roles. Again, that helps with ensuring that our registered doctors and nurses can focus on the things that only registered professionals can do. We're implementing a lot of apprenticeship routes into qualification, and that includes in pharmacy particularly, and also in paramedic world. Our ambulance service is particularly innovative in its recruitment and retention approaches. We're also working in collaboration with our partners to make sure, again, that where we have very small subscale services, we can rely for properly qualified clinical advice on partners perhaps across the Solent to make sure that we use the resource that we have on island as efficiently and effectively as possible. In addition, along with many other organisations, we're keeping our offer to new recruits under review. We are confident and indeed have seen the benefit already of our transfer into good rating on our attractiveness as an employer. So we are optimistic that we're closing a lot of our gaps. There are undoubtedly some areas where we continue to have specific troubles. It's on our risk register and we acknowledge it and manage it on a shift by shift basis on some occasions, but we're doing a lot of strategic work to try to ensure that we remain an attractive employer. Thank you.
I was just going to add, in the Chief Medical Officer's report last year around coastal inequalities, that issue was raised and there's some work nationally, and I'm very happy to reconnect following this meeting and say we've discussed it because we've talked about actually we want more training places. If you train in London, you tend to stay in London. So actually, why don't we train locally? And so we've picked up that conversation and had that. So I'm very happy to connect in and just kind of re-emphasise the importance we see of that.
Michaela?
I'd absolutely echo what Simon said, and I think it's really important we reinvigorate that work. In addition to all of the things Lois has talked about the Trust are doing, which are really extensive, I think the other thing that really strikes me is that coastal inequality issue you flag and the challenges of commuting to the island and making the island an attractive place to work is one that we've got to work on collectively. We need to think about how do we make it easy for staff to transfer, for example, between Solent mainland providers and here on a really easy basis, and that I think that has to remain a priority, and I'm thinking some of that might come out in the CMO report, so we'll have a look at that.
So I think, Councillor Nicholson, as you can see, we're all trying very hard. I have raised the issue with leaders in Portsmouth and Southampton or indeed with government over the importance of our link with the boats and the ferries and the travel and the patient transport. It's an issue that I raise on a regular basis because it's so important. So thank you all very much. It seems like we're all trying our absolute hardest on this. So thank you very much. Okay, so we're moving on to item number 4 on the agenda, which is the chairman's update. So we've got the pharmaceutical needs assessment update. A local steering group has met, including representatives from NHS England and Community Pharmacy South Central, to review the contents and structure of the document. The contractor questionnaire has been issued and responses collated. A draft document will be circulated to NHS England and Public Health Management Team prior to 60 days publication, consultation period and sign off by the board in autumn. Simon, is there anything you wanted to add to that statement?
It's just to say this is a responsibility of the Health and Wellbeing Board to do the pharmaceutical needs assessment. It is a market entry document about where pharmacies are. So we are doing that as part of our statutory duty, and that will come back to the board in the autumn.
Okay, and Amanda's one here, but violence against women and girls. Violence against women and girls has been brought into sharp focus by recent tragic and high-profile cases. However, these are not isolated incidents, and violence against women and girls is not a new challenge, sadly. The Police and Crime Commissioner for Hampshire and the Isle of Wight is committed to developing this work and set out some key actions that are of relevance to health and well-being. The letter will be circulated with the notes, and I agree that this is an important area of work we are pleased to support and input as appropriate. Our Director of Public Health is working with Jim Pegler, taking this project forward for the island. and I've attended a number of training sessions, which is really, really good. We just need to get the message out there. So thank you to everybody for that. Okay, so we move on to item number 5 to receive an update on the current COVID situation. That's you, Simon.
I'll do this very briefly, colleagues. So since we've last met, we'll know all the data has changed. So you'll be aware that testing has stopped for the whole population. You may well remember right back in the beginning, we had Pillar 1, which is in the health sector, and Pillar 2. So all of Pillar 2 is gone. So now we are just looking at Pillar 1 and the COVID infection survey, the CIS, which is the national survey that they look at COVID. And that looks at the prevalence of the virus. So when we look at where we are on the island compared with the national survey, we are in line with that. And what we are now seeing is that cases are plateauing and coming down. That's not to say the pressure on the hospital isn't there, but actually community cases we're seeing coming down. But I know we've all known people who've had it recently, and it's still an important matter. But the data is not as strong as it was. We are doing a lot of work to look at outbreaks, managing those, and I know we do that very carefully on the island, and we haven't got any particular issues we are concerned about at this point in time, but continue to monitor that. So what I'd suggest, Chair, is that in future meetings, health will be, well, we don't have this as an item because the data is not there, but of course, as Chair, I can add some to your Chairman's announcements in future if that would be helpful.
Thank you. I'm quite happy for that item to be removed, but we just do think. Thank you. So we move on to item number 6, which is the COVID-19 recovery plan. That's you, Chris, if you could give us some details. Thank you.
Thanks, David. Just for the benefit of our new attendants, my name is Chris Ashman. I'm Director of Regeneration, the Isle of Wight Council. The board will be aware that the recovery process in terms of an integrated recovery cell, multi-agency, has continued. And whilst it's great to hear, obviously, the infection rates and the impacts are the obvious impacts are not as significant. Clearly, the continuing impacts of the pandemic will be with us for some years to come. So the board accepted responsibility to oversee our recovery approach on an island basis over a year ago, and identified 3 key areas of recovery around community, economic and place recovery. At the last meeting, we obviously updated on the key areas of oversight which the board wanted to keep an eye on, which were particularly around the issue of housing needs, both in terms of immediate need and obviously supply in terms of affordability, the issue of anti-poverty, community recovery and sustaining the role of hubs in communities, education, mental well-being, commemoration of what happened, and also a celebration of the community's response. Overview of the Kickstart Another Unemployment approach, and an approach to promoting the island as a place that is resilient and has recovered and is open for business. So I think the most significant item I want to bring to the board as an exception on that is the anti-poverty approach. What we're hearing at the recovery cell on a continuing basis, and also from those in frontline roles in the community, is on the back of the pandemic and obviously the impact of the cost of living crisis, we are seeing increasing pressures on both the food supply and emergency food supply sector, and on the support for mental wellbeing services. So the challenge we have is that whilst there's a very effective and progressive officer-based approach to tackling anti-poverty, the feeling in the recovery cell is that isn't getting sufficient profile. And what I would be asking the board really is to obviously include that particular issue of anti-poverty as a future priority issue within our action plan. We are covering these issues later in the update of the wellbeing strategy, but I have been asked by Recovery Cell to bring that particular issue to bear. I can regale very distressing examples, but I don't think it's necessarily helpful to do that. But I think it's just worth saying that in the key area of, for example, of food banks being able to store sufficient supplies of food on the island, again, our island status being a key issue there, of particular types being a real problem, and also the distribution from a single point of that on the island. The food banks continue continue to struggle with that. So just as one example then, taking forward the issues relating to next winter, whilst there's a general perception that people are coping, but are stretched, both individually and collectively as organisations, the impending cost of living increases leading into a future winter are not worth contemplating. And that's, yeah, I'm not trying to upgrade it too much. This is the feedback we're getting from frontline workers. So to actually take forward a strategic approach and commitment by the agencies in this island to tackling that in a progressive way, we have to recognise our limitations. Clearly, our colleagues in the Department of Work and Pensions are working very hard on a national level with anti-poverty measures, finding people work, etc. And the scope and budgets we have available to us are limited. But I think it's fair to say we can learn from other parts of the UK that have focused in particularly on child poverty, but also more anti-poverty measures more generally, and actually bring that to a higher strategic profile. That's the one I really wanted to highlight, Leader. And on the economic recovery piece, things I hasten to add are looking fairly positive. The message we've had from the business community on the back of all the grants that we've received is that there's been a good sustainability rate. We haven't had that many significant closures. There have been the odd few, but obviously the number of grants and support that's been provided should help us recover a position which was fairly strong when we went into the pandemic, and hopefully now will enable businesses to move forward from there. On the government side, obviously we heard a lot about the levelling up agenda, and the government's recent announcements literally only last couple of weeks. That's why there is no paper for this meeting, I'm afraid, Leader, around their shared prosperity fund to help close the gap between poorer parts of the UK and the more affluent parts of the UK. Clearly, an allocation has been made to the Isle of Wight. The local authority is proposed to be the agent of that support and funding. The method by which the government has allocated an amount to the island has been based upon the historic use of European structural funds. And as most people potentially in this room will know, the Isle of Wight wasn't a real beneficiaries from that in the past. So unfortunately, that has meant that our allocation for the next 3 years is just short or just over, literally just over £1 million to support interventions to improve skills, to help with business support, and to work with communities and places. So that really puts an even more strategic emphasis on that anti-poverty agenda as to how best we use those additional limited resources to actually tackle and reach the communities that need that most. So obviously we'll be taking papers to Cabinet, identifying how we might propose to tackle those issues. And obviously I just wanted the board to be aware of that on the agenda as well. I could talk for another 10-15 minutes on the other aspects. On a more positive front, the Island Place marketing approach, very much led by a group of local businesses, identifying the need for a dedicated and promotable website for the island, selling the strengths and the assets of and the benefits of doing business and living on the island. That work has begun, and obviously I'll keep the board appraised as to the key elements of that and the timescales from when it goes live. But yeah, obviously we're committed. I think the board asked for the recovery cell to be sustained and resourced at least for the rest of 2022, and obviously I'll continue to provide the necessary regular updates to the board on progress of that. Thank you, Leader.
Councillor Andre.
Thank you, Chair, and thank you, Chris, for that update. Firstly, I would like to pay tribute to the team that actually initially put together the Keep the Island Safe programme. I think they're very much the unsung heroes, and the fact that that programme is actually still in place and has provided a very wide range of support to people at the time when it was most needed. So I think that that's been a real benefit of this. In terms of food banks, I think most people would agree that they are not necessarily a sustainable long-term solution. I'm absolutely delighted to highlight that my team, on Tuesday, I was at the launch of our first community pantry, and the community pantries already up and running in Hampshire It's the first one on the island. We have plans for 5 of them, and they work in a slightly different way from food banks. It's a membership scheme where people actually pay in. It's at the moment it's at £5 a week, and they actually are guaranteed at least 3 times that value of food. So it's on a weekly basis. They do not have to be referred. Anybody can go and join as membership. The other significant difference, well, there's 2 really. One is the fact that they can get a full range of fresh, frozen and store-covered ingredients. And I've actually asked, and apparently this is happening, recipe cards are going to be supplied so that people have got an idea. You know, I mean, lots of people are good cooks anyway, but it just gives a few ideas of of how to make the most out of those ingredients. And the other thing is coming out of it, because it's actually a membership, the people that run those community pantries will be building relationships with the members and will be in a position to identify any additional needs and signpost on. So I'm really excited about the community pantries. I really think they are the way forward. The other thing you mentioned about distribution, Chris, the community pantries are already working with an on-island provider that connects with the supermarkets who supply them. And the intention is that we will source and establish a central store so that when the community pantries are up and running, they can actually be fed by that one central place. So it actually makes it work. So I'd just like to highlight the great work that's been done and is ongoing. So I look forward to the opening of more community pantries on the island. We've also targeted those areas. The first one opened in East Cowes, and we've targeted the areas where we think the poverty is highest and that it's most needed. Thank you.
Kim?
Thank you. Just to say that the other 2 are in Ventnor and Ryde, and they're planned to open in May. So that fits in with what Councillor Andre said.
That's fantastic. Super. Michaela?
Thank you very much, Chair. Thank you. I just wanted to say I cannot stress enough formally the support for Chris's comments about treating poverty as a multi-agency issue and keeping it at the heart of that recovery cell. We are really clear as a health system, and I know everyone in this room is really clear, that poverty is the major factor in being a poor determinant of health, and that is specifically true, we know, in some places on the island as it is across the country. So thank you very much for asking us to endorse that, because I would say that is an absolute key priority for us across all our services.
Okay, Simon?
Just very quickly, so in the health and wellbeing strategy that we're looking at later on in the workshop, it's got inequalities and recovery. We can strengthen that into poverty, but I think inequalities, because we want to improve the health of the poorest fastest, does cover it, but we can really add to that today.
And I can say as an administration, when we have a little bit of a reshuffle and move around, poverty will be on one of our top priorities that we will be dealing with, along with housing and homelessness. Those will be our priorities that we're working on. We've already discussed that as a group. Thank you. Kim?
Yeah, just to echo, really, we're really starting to see the impact of poverty on the families that we're working with. There's been a 37% increase in children claiming free school meals on the island in the last year. And certainly our early help interventions, the impact on that part of the service has been noted in terms of poverty, around fuel poverty. There are some really good support in place through the Holiday Activities Fund, and I think we issued over 32,000 food vouchers in the last year to support families. So I absolutely agree with colleagues around the table. You cannot underestimate the impact of poverty on our communication and our work with families. So I just think it's really worth noting.
Which was why when the administration in May got in, I said our priority is coming out of COVID financially, mentally and physically well, that those were my priorities, and they continue to be my priorities, because this is with us for a long time. This isn't an easy, the infection might not be there, but the long-lasting effects, particularly around mental health and things, is just continuing.
I would just like to add that I think we would like to think that the infection is not there, Chair, but unfortunately the infection is there. I just thought maybe for the accuracy of the meeting, we've still got quite high rates. So, and also I think in our planning, we have to consider surges in the winter as well, and the impact that will have again on people's recovery. Thank you, Chair.
Yeah, you're quite right about the winter pressures again, and the flu, and whatever is going to come from these, and then the new mixture of infection that comes from these. Okay, are there any other questions on that item? No, so we move on now to the strategy updates, which is the health and wellbeing strategy. Who's presenting?
So just very quickly, colleagues, and for formally noting it, the board, because we're going to work in a workshop, we are developing our health and wellbeing strategy for the island, and it's got 4 themes. So they are tackling health inequalities and recovery from COVID, linking to Chris Ashman's work, improving health through housing, because those links, as you say, Chairman, are really actually really strong, and our role is around health, so that link's good. Mental health and wellbeing, we've talked about that a lot, and we'll be focusing on that area, and then supporting the delivery of the physical activity strategy, which we signed off last year. So those are the 4 themes that we're going to work on in a workshop later on, but as a formal board, I wanted to just say that's where we are, and we'll pick those up later on this morning.
I must say, when I looked at this, I quite liked the action plan. It was very easy to read what we were trying to achieve March, April, May, with the exception of one piece, which I thought I was quite creation of working groups aligned to pillars of opportunity, which was I thought was a little bit of a mouthful. Probably could have been said a little easier. But apart from that, I like the way that the plan is set out. It gives us actually clear objectives, what we need to achieve and when. Thank you. Are we discussing the health and care plan next? Oh, as if by magic, Michelle Young arrives. Welcome.
Thank you, Chair. Thank you. Obviously this board received a summary of the health and care plan in January, and we produced our first draft of the final document to the ICP board in March. Simon and I were then tasked to align the health and care plan with the health and wellbeing strategy, which is Simon's obviously just mentioned. So the slides that you have as part of your pack is our attempt of showing how we can actually align those 2 pieces of work. So in effect, what the health and care plan will be is the delivery vehicle for the health and wellbeing strategy. And on those slides, it does give an indication of what the priorities of both documents are. So the plan is that we will take a final version to the ICP board in June. We are currently working up the public-facing document. Now we have been in receipt of the summary report of all of the health and care conversations, which we've had a tremendous response on that. And just so for the board's purposes, that what it's basically telling us is a lot of our residents have concerns around access to our services. So we need to make sure that that messaging is in the health and care plan. But I don't think there's any sort of surprises in there. So what I would propose is once we've obviously completed the document and it's gone through the ICP board, is that we bring it back to the Health and Wellbeing Board for your site and for sign off, if that's okay.
Okay, that's a proposition. Is everyone happy with that proposition? Thank you. Councillor Ian Stevens?
That means that all we're going to do is rubber stamp this, and I'm a little bit concerned. I know the Vice Chair wants to come in, but I'm always concerned that we're presented with fait accompli and we rubber stamp something. So yes, it's wonderful. I'd like to see the results in draft and then take it forward, because we won't be able to change it once it reaches the board. Thank you.
Thank you, Councillor. I sort of agree with you in certain aspects, and I think there is a tendency to rubber stamp plans, and we've got the plan. However, this is quite different in several ways. Firstly, it's got buy-in from all partners on the island. We've done a lot of work on it, and we have brought it to the Health and Wellbeing Board before for comments, so that you had an opportunity to contribute. We feel very strongly, the group that have been leading the design of this plan, that actually a plan is only as good as what we get out of it and what we do with it. Now, people will know I'm a doer. I don't actually like plans. I'm excited by this plan, but I'm excited by what we're going to do with it. And there is an awful lot of energy within the partnership, within the system, that actually what we're going to focus on in this plan output is actually probably frailty and dementia, and look at that across our system. We're definitely going to have outputs, and we are going to see results because we've got so much buy-in across the system. It's not just one partner doing this. We've all worked together on this, and I think that's what makes this plan quite different. It will come under your health and wellbeing strategy, and actually it'll be the output of that, and it'll be the doing document for some of that health and wellbeing strategy. It's not all of it, and of course there's so much more in the strategy. It's not just about frailty and dementia, but if we looked at this, we could actually impact so much on a certain cohort of our population who suffer enormously. So I hope you feel reassured by that, Councillor.
Councillor Stevens?
I'm reassured that you will bring the outputs back to the Health and Wellbeing Board, where we can scrutinise and discuss those outputs and make sure that we maximise all opportunities. Thank you.
Councillor Love?
Thank you. And just to reassure Councillor Stevens that there is a significant amount of activity that I'm seeing taking place right across the board in all areas. Everybody's, in children's services, in health, even within GP practices and the NHS. So I don't mean even within, but I mean you would expect it to see it there. That was the wrong word, wasn't it? But I am seeing a significant amount aboard, and I agree that the strategy is what holds, is that we use as markers and indications of moving forward, but in actual fact it's about the work that we do which really matters, and I'm confident that I'm seeing a significant amount of input there. The output is what we really want to see. I always say I want to see that much of the problem, but I want to see this much of the solution and the outcomes, and I think that that's really important, and I think it's going to be difficult. Nobody's saying it's not, particularly when we've got, new additional pressures created. We will see additional pressures created in mental health and wellbeing because of people being concerned about fuel poverty and all of those things that are likely to hit us and are hitting us now, but will have a greater influence. And I think that's where we need to try to focus our activity on the prevention of mental health and ill health as we move forward into the winter, particularly when people have to start paying bills after winter. That's when we're going to see pressures, particularly where people might feel even uncomfortable about their own existence in terms of suicide and things, because of not being able to deal with the pressures of living life and paying the bills. So that's where I would expect to see some pressure points, and I just encourage partners to think about, we can see it coming in terms of the pinch point, and that's when we need to really kick in and work as a team, and I'm confident that that's happening.
Michelle?
Just to absolutely, totally agree with Councillor Love's comments, but also that is actually magnified in our elderly and our cohort of elderly population on this island and people with dementia. So everything that you said will be magnified in that group. Even more important for us to get cracking on making sure that we have a really robust frailty and dementia pathway on the island that's working well. Thank you.
Can I just apologise for not being here at 9:30? I could have been here at 9:30, but in actual fact, I've got 10 o'clock in my diary for some reason.
Okay, so we're moving on Thank you, Michelle, for that. And as I say, I did like those. It was a very easy pattern to follow, and I think it's something that that we can easily keep track of, as opposed to a document that's just a lot of rambling words, but not actually written down. Thank you. So we move on to item 8 on the agenda, which is the. Oh no, have we done the health and care plan? We've just done that, haven't we? Done that, yeah. Okay, the public health annual report, item number 8.
I'm relying on Marie to do. Is there a clicker or shall I? Grand. So every year I have the privilege of writing an independent report on the health of the population, the health of the island. It's a unique report because I have freedom to say anything about the health of the population. This year I focused on the health impacts, the mental health impacts of COVID, particularly relating to lockdown 1 and 2. So what we've seen there. So if you can click on. So we've had some other reports previously, and this year I really want to focus on mental health because it was talked about a lot during the lockdown, and actually we need to do an assessment of that. So the report's there, and I make some recommendations, and we'll talk about it in a minute, but I would like partners to think about what they can do to implement those recommendations. The next slide, please. So, as I said, I think it's kind of fairly repetitive here, but it's thinking about specific groups, highlighting the inequalities in mental health and well-being, and what we need to do to address them, and the fact we need to work across the whole system. So we know it's uncovered inequalities. Chris has talked about some of that already, and they will worsen, as we're all hearing, unless we take some action to work together. I think one of the sad things about COVID, we really had to take some very draconian measures to prevent spread and protect life. That was absolutely right. It's a brand new virus, but some of those things will have impacted on the population in a way that wouldn't be good for them. So we know different groups have been disproportionately affected by that. And this report highlights those groups, and the report is in the pack. Thanks, Marie. This slide really shows those connections around health and well-being. It's, as we've talked about, the wider determinants of health, economy, debt, unemployment, and then those social factors about connectedness. And then they link to health behaviours, and then the psychological impact, you'll start seeing high blood pressure. And so the links are all there. I've talked to my kids, in years to come, you'll say, I wasn't allowed to go to school. That's a very unusual thing to say. We're all supposed to go to school, but we weren't allowed to go to school. And what did that do? Apart from parental stress, which is probably a different thing. But those things, people couldn't go to work, they were furloughed. What's that? So we've tried to explore those things as much as we can in this report. So we have a mental wellbeing vulnerability index. I think we need to really think about it doesn't match deprivation, and sometimes we forget that. So the impacts of mental well-being are different from deprivation. They're not completely different. So we've done a lot of work on this, and you can see the areas where there is more mental health need. It's based on an index we borrowed from Kent to look at many, many different factors, about 40 different factors around mental health and well-being. But you can see across the island those factors there.
Simon, can I just ask, I mean, I know that prison data is included. Is that why there is a spike in Parkhurst?
I don't think it is, but can I just check that? Because sometimes the prison is included and sometimes it's not, depending on what we're looking at. For social factors, when you're looking at communities, it wouldn't be. For health factors, it may well be.
You have got a document from the prison, but it's 2011, so it's quite out of date with their data. That's quite some time ago.
Let me just check that.
Chair, can I ask?
It's really quite interesting to see the cows.
Sorry, it's really interesting to see that cows is in that area, particularly as you've just stated about areas of deprivation. So there's a clear, and it's understanding that what's happening there that really matters, so that we can target that. But that's really quite interesting. It looks like it goes round into Gurnard as well.
So some of the factors we looked at were about social connectedness, and some more areas where there's less wealth have more connectedness. So there's lots of factors to unpick, but I think it's a really useful index we can use, and we'll make sure that people like Leslie Stevens are fully aware and sharing that. The next slide, so we focused on children, adults and young people. So We know those groups will be most affected, those who are pregnant in early years, school-age children, particularly those as with special educational needs and looked after children, were particularly impacted, more impacted than others. So we're doing a rapid needs assessment to really understand the full extent of the population's need so that we can develop a system-wide approach to improving mental health and well-being of the population. Because we know happy children, positive relationships, grow up to be healthy adults. So we really want to unpick that. The next slide focuses on working age adults, and those little bubbles really kind of bring it home to me around the impact that the measures in the lockdown had on our population. Social isolation, job losses. You know, we didn't see family and friends for a long time, and it was, and that's been impacted. Or working on the front line was equally a different kind of stress. And I think, you know, we all worked in a different way around this table through those places.
I mean, sorry, could I just quickly come in? We skipped very quickly past children's and young services, and I have to say, I'm really pleased that the press are here. We've got probably the hardest working press person I think I've ever known, because she's absolutely everywhere, and I pay credit to the amount of hours that she puts in. And I think it's really important to highlight some of the horrendous things actually that you've discovered in this report, in as much of that when you took a survey into the children's mental health from the Youth Trust, that 33%, 33.5% of secondary school were reported as feeling worried a lot and finding it hard to sleep. 30% lacking energy and enthusiasm, 29% felt very angry and losing their temper. These statistics are absolutely horrendous of what our children are going through. And I think that it's the tip of the iceberg. These children are our future and need so much of our help and support. I'm concerned about the SEND issue that we've got as well, that we know that trying to move people into that. The looked after children, you know, again, that we know that there's issues in and around that. And a thing that was missed on almost all of this paper is our home educated children and those excluded. I have real concerns that nobody is checking on children that aren't home educated, maybe. We know that there are certain issues. I know I've spoke to Jim Pegler, and there are real issues around certain individuals and children. I just think, again, in the report, we need to hone in on that and get a little bit more data around that to see what support that they can need, because it's obviously schools. I mean, you know, our children are the future. You know, I keep saying they're the carers, they're the people that will be working in the hospital with us. And if we fail them now, we've got to put things in place. So I know we went over that really quickly, but it's really highlighted, and I hope that the press can pick up on some of those facts, because we need to go out there to do stuff. Councillor Andre.
Thank you, Chair. If you'll indulge me, I think I'd like to reiterate the point that it's got to be a multi-agency approach. We can't just look at this piecemeal. We have to come together on this. I'd like to highlight the fact that we commissioned Bernardo's to provide our families service, and in fact our family hubs have been raised as an exemplar. But what actually does concern me is the 4 tiers in children's mental health, where the thresholds are, because I've been into the family centres and spoken to them, and it would appear that young people and children are being presented to them with thresholds that are actually higher than they are commissioned to deal with. And I've also been into CAMS, and I know whilst they provide a fantastic service, I think it's evident that with the effects of COVID, they are absolutely struggling to the waiting lists. And again, with the Youth Trust, they do some fantastic work. And in fact, their surveys are extremely good pieces of work that are very useful for us in identifying. But I think Chair is absolutely right that I think we do need to look more deeply into those issues. In terms of exclusions, we are aware that that is a problem. We have the Island Learning Centre as our pupil referral unit, but we are potentially looking at different models because we need to work very closely with the schools. I have to say, I don't think permanent, from the data I've seen, I don't think permanent exclusions are so much the issue. It's those suspensions and our young people being out of school, but also the fact on the home educated, as people will know, we have one of the highest rates in the country, about 5%, as opposed to national of 3%. But that's partly possibly because of the island community, we are aware of them, but government are actually proposing that all electively home educated children are registered, and I would fully support that because I think it is a rarity, but there is always that possibility if children and our young people are not registered with any of the services and they are electively home educated, they could go under the radar. So we are aware and we are looking from a strategic level at how we can address those issues.
Thank you for that. And what I would say, I think it absolutely shows our passion as an administration and how strongly we feel about our residents on the Isle of Wight and what we can do to help. Simon, sorry to interrupt, but I just thought it was really important not to gloss over that with the press here. We need to make people aware of what we're facing and staff shortages in trying to deal with the issues that we're dealing with. Thank you.
No, at all. And the enthusiasm and the issues are absolutely right. Just so we're aware, this is a report on the lockdown, and the issues you've talked are much wider, but they're not wrong. And I think exacerbated. And I think we've seen one of the issues that children and young people found was, lack of control because they couldn't control what was going on. Yeah. And I think we need to be aware of that, particularly with what's going on in our world situation, and understand the control there. Finally, moving on to our older people. Really, the key thing for me, and Michelle's talked about it, is that kind of frailty issue that people had reduced physical activity. How do we live longer better? Increased social isolation. I can't imagine being an older person living on my own during lockdown. I live with my family. It must have been really, really difficult. And then confidence. People lost confidence and how to socialise, how to connect. So those things really came out as really important. So finally, we've got some things we are doing to address that, and it's in our health and wellbeing strategy as a key strand, and I think that's really important. And our recommendations at the end, Marie. Sorry, me picking up. I think the recommendation on 2 pages. So priorities there. I'd ask members of the board, and maybe Marie can be cheeky and do an email afterwards and say these are recommendations. What are your organisations going to do to help us meet them? But as I say, it's an independent report that I really value doing and enjoy writing, and we've got a joint student needs assessment which will pick up all these issues, and it's really helpful. We'll focus on some of those things. So thank you very much.
No, thank you very much. It's another shocking statistic was that 85% of older adults are living with depression. That is absolutely horrendous. Honestly, the report, I was sat reading it. Maybe I shouldn't have sat reading it at 11 o'clock last night, but it sort of hits home. We've just got to do more. We've got to work together, and it is cross-agency. This is really seriously cross-agency. Thank you very much. Quickly.
Thank you for your report, Simon. I go back to what we were saying before, is that we can describe the problem in detail. It's not the problem, it's what we do about it that really, really matters, and our organisations, we've got all kinds of organisations, People Matter, all of those organisations working together. Thank you for your report. And in addition to that, we didn't, Simon didn't report about all the other work which is going on within our sexual health services, who have been doing a great job within our drug and alcohol services, although it was there as a recommendation at the end. We've actually done really well to keep those services moving at all during the pandemic, but that doesn't mean to say that we're taking our eye off that. So, but again, thank you for your report, but remember, it's what we do about it is an outcome that really matters. This is a report which I say is a snapshot in time, and some of those details have already moved. The other bit which will complicate this as we move forward in terms of statistics, which we have no statistics on at the moment, is what happens with our influx, if you like. of Ukrainians coming to this UK who will have complex medical needs, which all need assessing, and there'll need to be some prevention work and support work done there. And again, and just need to say that the response from through Wendy Pereira and her team has been really quite outstanding. People have really come together in that. But again, it's about the output that really counts. We need to understand where that is. We still have difficulty with government because we can't have access to the data. The data follows the people rather than preempts the, the position. And that will mean that we will have to look closely at the health and wellbeing. I'm expecting, particularly in the mental health areas, that there will be some issues around trauma impact for these people and recovery moving forward. But the last bit that I do want to do, which wasn't really discussed, is that we still have one of the biggest single care issues that I have at the moment, being referred to me, is dental health care. Okay? It keeps coming up and coming up and coming up, where we have people, where we've had examples highlighted to us by Health Watch, where people are gluing their teeth together. You know, that cannot be. And so that needs to be, whilst it's some people don't see it as a life-threatening, but toothache is actually quite, so those are some of the things that we need to deal with, and those are what I encourage people to work on.
Thank you, Councillor Love, for raising that. And I know Councillor Nicholson is working hard, as I have been beating my head against a brick wall since 2006, raising the issues then. If things were put in place in 2006 when I raised it, maybe we wouldn't be in the situation we are now, but there we go. Okay, so Simon, thank you, and to your team for putting that report together. Nice picture of you on there, I have to say. Yeah, looking quite dapper there. I move on now to item 9 on the agenda, which is members' question time. Councillor Nicholson's already asked a question earlier. Are there any others, Simon?
Councillor Love's absolutely right around Ukrainians. And I think it's as a system. How do we understand the needs? You're right. We can assume, but I think we need to be really careful and understand that going forward. And I think that's a really important piece of work we should do.
Thank you. So there are no members' questions time. So at 10:22, according to that clock up there, I call this meeting to a halt. Thank you.
Just so we've got a workshop around the strategy starting shortly, and we'll do that more informally.
I will be bringing in teas and coffees to warm ourselves because I'm frozen, to be honest.